And what about medical culture? Are there differences in medical culture between Turkey and Uzbekistan? And I'm going to be a bit more specific on that. Looking at some of your pictures, for example, on university, I've noticed on some of them you are wearing some kind of white hat that's unlike anything I've ever seen. It's a bit tall, almost like something between a surgical gown and a top hat. I've never seen anything like that before. First, what's the meaning of that? Second, is that Uzbek or Turkish or both? And three, does it represent a difference between medicine in Uzbekistan and Turkey? Are there differences in this style, in the way you dress, in the way you behave, for example, between a hospital in Uzbekistan and a hospital in Turkey?
Yes. First of all, Turkey it's one of the best developing countries in medicine. Secondly, you won't just receive a diploma, but real knowledge and experience in this area. And certainly, graduating from a Turkish med school allows you to practice worldwide. And in addition, you will attend hospitals and clinics and work with patients while being advised by experts. Like this, for this reason, and Turkish university is better, I think.
And what about the hatch? What does the hatch mean?
It's Kalpachok. All of them. It's in Uzbekistan. In Uzbekistan, it's Uzbek classroom. In Uzbekistan, has their name is Kalpachok. All students need to wear in the class. I don't know why. One day, Turkish teachers came to Uzbekistan and they say, "Why you here like this white hat?" We say we also don't know. It's Uzbek rules. In this class, we teach from microbe, like germs. We learn from germs. For this reason, they don't want to our hair live there. For this reason, maybe.
Yes, but you could just wear some kind of surgical apparel, some
I also
kind
don't
of.
know. It's Uzbek rules. In the class, all of the students Uzbek rules. I say in Uzbek when some kind of students want to study in Uzbek medical university, they must to wear always white coat in the class, and in addition white hat, and in addition they also will be on time. Don't late. If you late or 5 minutes, teachers don't obey to enter the class like this. If you don't come to lesson 2 days or 3 days, they don't permit to enter the exam. They say first of all you need to repeat C and say for me. After then I permit to enter exam. Teacher said in Uzbekistan like this. But in Turkey, when you late 5 minutes or 20 minutes, they permit to come to the lesson.
Yes, here in Brazil at least.
And in the Turkish lessons, when Turkish teachers teach in medical knowledge, if we enter the classroom with coffee or like some kind of snacks, they don't say anything in Turkey. But in Uzbekistan, when you enter some kind of coffee or water, they don't obey. They say it's not coffee. Don't drink coffee and some kind of snacks in the class. But in Turkey, they obey. They don't say anything. Like this different.
Yes, here in Brazil, at least on the university I attended, we had something like in between. As a general rule, we did not have to wear white coats or any kind of hat, at least not on classes. It's a different story when we're actually seeing patients. When we were seeing patients, we have to have white coats. But regarding, for example, snacks or coffee or being late, that depended a lot on the professor. Professors had, so to speak, a lot of autonomy on their own classes. So, for example, there were professors who would pretty much let you arrive and leave whenever you wanted. You could arrive 1 hour late and still go into the class and watch it. And there were other professors, stricter ones, that pretty much were more like this. No, if you are 5 minutes late, you can no longer enter the class. But that level of strictness was rarer.